I'm Cassie Root, and I'm at the Nurseral Orthopedic Center in Arlington, Virginia, outside of Washington, D.C.
Who are your mentors in hand surgery?
So that's a great question, and one of the things I feel really fortunate for is having so many great mentors. So both between my residency at Hospital for Special Surgery and my fellowship at WashU, it's really almost too many to name, and I wouldn't want to leave anyone out. One of the things that I love about that is that I really had the opportunity to form a relationship with each one of them, and I feel like I took something away from each one of those relationships, and I carry like a little piece inside me, whether it's in life or in my practice. And so obviously I wouldn't be here without them, and I'm eternally grateful.
What's your favorite case in hand surgery?
So I've really grown to love treating Dupuytren's disease. I really enjoy tailoring the treatment to the patient and really getting to know the patient and getting to know, who that hand belongs to and what their goals are, and how we can best accomplish that, because we do have different options and it's not a one size fits all approach that I take. So I really enjoy the sort of detail and nuance to treating the individual in that disease. And I also like the cases. I think the anatomy's, fantastic when you do those cases. I love doing them with students and observers. It's a lot of fun.
Tell me about a recent difficult case.
So it's not a surgical case, but I had a young lady who had a fall back in June a year ago, and she didn't come in for an X-ray until months later, and there was evidence of a scaphoid waist fracture. She didn't actually then end up showing up to me until earlier this year, and unfortunately was 6 weeks pregnant. So I did get some new shielded films, and the fracture wasn't evident anymore, and it was a little confusing. So I got an MRI, and there's this pancarpal edema throughout the carpal bones and a lot of synovitis, and she has extremely limited wrist range of motion with a lot of pain. So I was a little bit stuck. She's had a full room workup that's been negative. I thought about an open biopsy, but it wasn't really a good choice with her being pregnant. A CT might have been helpful as well, but put that off as well. So I tried to aspirate it, couldn't get fluid. I discussed the risks of a cortisone injection and gave her one. And she's got some pain relief, and she's in therapy, but I really wish I had better answers for her. She's got to face taking care of the child, and she has really limited motion, and I think she's going to have limited options down the road. I would love to understand better her disease at this point.